Hello, and welcome to Santa Rosa Memorial Hospital's Center for Bone and Joint Health Total Joint Replacement presentation. Studies show that educating yourself pre-operatively leads to successful outcomes post-operatively. My name is Jessica, and I am your total joint patient navigator. So along with inviting you to attend joint replacement class today, I also navigate you through the entire surgical process. I act as a liaison between you and your physician, and I am here as a contact for your surgical process. So please feel free to call or email me at any time during this process. This program will review what you can do to best prepare for surgery, explain your surgery to you in a way that's easy to understand, the rehabilitation process, discharge process, and getting you home after surgery. I will start class and talk about 2 weeks prior to surgery, a few things that you as the patient need to avoid 2 weeks prior to surgery. So the first thing that you will need to avoid is any invasive dental work. This does include teeth cleaning. So if you have something scheduled 2 weeks prior to surgery, please reschedule that. We would also like you to avoid having any manicures or pedicures and having your cuticles cut. Please stop taking any herbal supplements 2 weeks prior to surgery as well. Herbal supplements such as vitamin E, fish oil, and omega-3s, you will absolutely need to stop taking. If you take any other herbal supplements that I do not have listed, please consult your surgeon about that. Some of these herbal supplements can adversely react with the blood thinning medication that you may be on after surgery. We also ask that you stop shaving your surgical extremity 10 days prior to surgery. We also request that you schedule a follow-up appointment with your primary care physician within 2 weeks after surgery, as well as a follow-up appointment with your orthopedic surgeon within 2 weeks after surgery. I will now take a little bit of time to talk about optimizing your health before surgery. So I will let you know that the use of nicotine products, cigarettes, cigars, gums, or patches has been shown to increase risks of complications following surgery. They can inhibit bone and wound healing by decreasing blood flow to the surgical site. They can also increase your risk of developing a blood clot after surgery. So if you or someone you know would like some more information on smoking cessation programs or resources for optimizing your health before and after surgery, please consult our Bone and Joint Health Network Navigator. This is at no cost to you, and you can schedule a consultation with your navigator through our 523 Bone line. Now I'm going to talk a little bit about medication safety prior to surgery. So some of you may be taking a blood thinning medication for a heart condition or maybe a previous blood clot in the past. If you are taking a blood thinning medication, please consult your surgeon about that medication prior to surgery. He may want you to stop taking that medication 7 days prior to surgery. Those medications include aspirin, Coumadin, and Lovenox. If you are currently taking any non-steroidal anti-inflammatory medications, such as ibuprofen, naproxen, or Aleve, please also discuss these medications with your surgeon. He may want you to stop taking those as well. Now I'm going to talk a little bit about the pre-admission process before surgery. So within 7 days prior to surgery, this becomes a very busy time for you all. You will have your very last pre-operative visit with your surgeon, and after that last pre-operative visit, you will be required to come over to Santa Rosa Memorial Hospital's admitting department and get pre-registered here in our hospital. You do not need to schedule an appointment for this registration process. At this registration time, you will receive one lab test. That lab test is called a MRSA nasal swab. MRSA stands for methicillin-resistant Staph aureus, and that is a bacteria that we test everybody for who comes in the hospital doors. It is a very simple test. It consists of 2 Q-tips, and you take those, swab inside each nose or nair, put them in a little baggie, and send them to the lab. As your surgery date gets closer, you will all receive a call from our EASE nurse. EASE stands for the Early Admission Surgical Evaluation Nurse. Now this nurse will call you and tell you all of the important information that you need to know before you arrive for surgery on the day of. So when she does call, set aside about 10 minutes to talk to the nurse. Please prepare a written list of the following. Any current medications that you're on with dosage and frequency. Please write down any allergies that you may have to medications or foods, and any dietary restrictions that you may have. She will be asking you all of these questions, along with letting you know what time to arrive for surgery, what medications to take the morning of surgery, and when to stop eating and drinking the night before surgery. Now I will talk a little bit about your diet prior to surgery. So it is very important for you as the patient to eat an iron-rich diet prior to surgery. You can start that as soon as you want. There really is no too early of a time. Eating an iron-rich diet may help boost up your red blood cells after surgery. So iron-rich foods include prunes, raisins, and lots of dried fruits, all kinds of green leafy vegetables, chicken, ham, scallops, and shrimp, cream of wheat, malto meal, and lots of other different foods. If you would like a full list of iron-rich foods, you can email me or give me a phone call, and I will let you know of all of those other foods. And part of the reason why we want you to eat an iron-rich diet and boost up your red blood cells is because when you have a surgery like a joint replacement surgery, you are prone to losing a little bit of blood. And so we want to, as your healthcare providers, prevent you from getting post-op anemia or post-op blood loss. So along with eating an iron-rich diet, there are two other things that your surgeons will do to prevent you from getting post-op anemia or reducing your post-op blood loss. One of those things is a medication that you will receive right before you go into the operating room. That medication is called tranexamic acid. So that medication will be administered by your anesthesiologist, and basically what it does is it prevents you from bleeding too much in the operating room and right after the operating room. The other intervention that your surgeon may have you as a candidate for after surgery is an autologous blood transfusion system. Essentially, that means that we have a cell saver technology. It will be hooked up to a drain right around your knee or hip incision, and it essentially recycles your blood so that it can be safely reinfused after surgery. Not all patients are a candidate for the cell saver technology, an autologous blood recovery system, but if you are a candidate, your surgeon will talk to you about that separately. So many of you who I've talked to over the phone or who are attending joint class today have asked me, who will assist me after surgery? Who will bring me to the hospital? So as your navigator, I encourage you to designate a coach or a family member or friend to help you through this surgical process. Your coach can be present during your hospital stay. They can help you with mobility and exercises and be present with physical therapy. And they can drive you to and from appointments before and after surgery. Your surgery may be canceled for a few of the following reasons that I will go over with you. So your surgery will be canceled if you eat or drink anything after the specified time that the EASE nurse tells you not to. So if she tells you to stop eating solid foods at midnight and you wake up and have a delicious omelet, your surgery will be canceled. So please follow those rules. If you develop any respiratory illness or fever within the week prior to surgery, your surgery may also be canceled. So if you do develop a respiratory illness or a fever, please consult your surgeon and call their office. If you develop any breaks in your surgical skin on your operative extremity, so a cut, a scrape, or an ugly looking spider bite, that may cause your surgery to be canceled as well. So if that does occur, please consult your surgeon. If you continue to take any blood thinning medications prior to surgery and your surgeon instructs you to stop taking them, such as aspirin or Coumadin, your surgery may be canceled as well. I will now begin talking to you about the process the night before surgery. So all of you have received a package of our chlorhexidine gluconate cloths. In this bundle, you will have 3 packages of the cloths along with instructions to follow. So the night before surgery, you are instructed to shower and then wait 1 hour and wipe down with the chlorhexidine gluconate cloths. The purpose of these cloths is to reduce your risk of a surgical site infection, so they're very important. On these instructions, you will see a step-by-step guide of how to use the chlorhexidine gluconate the night before surgery. So please refer to these instructions. There is a color diagram for you to go by. And if you have any questions, please give me a call or shoot me an email. Okay. Other things to remember the night before surgery. So as I said, you will be required to shower the night before surgery, use the chlorhexidine gluconate cloths, and then after you use the chlorhexidine gluconate cloths, we ask that you get into clean clothes, fresh out of the laundry, nothing that's been laying around the house or in the hamper. After that, we do ask that you get into a clean bed, fresh linen straight out of the laundry as well. Then you will go to sleep, wake up the morning of surgery, and come to the hospital for your procedure. The nurses at the hospital here, once you are checked in, will then repeat the process of the chlorhexidine gluconate scrub. Many people ask me, what do I need to bring to the hospital? What will I need when I'm here? So I will go ahead and talk to you about a few things that we ask you to bring to the hospital. The first thing that we ask you to bring is clothing that is loosely fitted. And we ask you to bring loosely fitted clothing because you will have bulky dressing over your knee or hip incision for the first 24 hours. And you may also have a nerve block if you are a knee replacement patient. So loose fitted clothing that's comfortable, easy to get on and off, and something you'll be comfortable walking down the hallway in. We also ask that you bring slip-on shoes, something with a non-skid sole. We do not want you falling. And if you wear glasses or a hearing aid, please bring those as well. If you have sleep apnea and you use a CPAP machine at night, we do encourage you to bring that also. Please do not bring any valuables to the hospital, such as jewelry. You are allowed to bring laptops, iPads, and cell phones if you'd like. We do have Wi-Fi, but we are not responsible if they do get lost or stolen. So when you arrive to the hospital on your day of surgery, please do not eat anything on that day. You may drink clear liquids up to 4 hours prior to surgery. Plan to arrive 2.5 hours before your surgery start time. And please check in with the admitting department, the same place that you checked into when you came to pre-register in the front of the hospital. So once you have checked in the pre-admitting department, you will be instructed to go over to the lobby elevators and up to the second floor. That's where surgery will be performed and where you will have the remainder of your stay after surgery. You will then be checked into the pre-operative area. In the pre-operative area, you will meet your pre-operative nurse. She will start an intravenous IV line and get some fluid started to keep you hydrated through surgery. You may also have some extra blood work done. This is also the time where you will meet your anesthesiologist and discuss any concerns about your anesthesia, any reactions that you may have had in the past, or preference of medications. All hip and knee replacement patients will receive a spinal anesthetic. In addition to the spinal anesthetic, all knee replacement patients will also receive a nerve block. It is dependent on your surgeon and your anesthesiologist whether or not you will have a one-time injection of the nerve block or a continuous nerve block that you may have for up to 48 hours to 5 days. The last person you will see in this preoperative area is your surgeon. Your surgeon will come around and initial your surgical extremity, and then you will be sent to the operating room for your procedure. In our operating room, staff takes special precautions to protect you against infection. Total joint replacement surgery, knee and hip replacement, usually takes about 2 hours for the procedure. After the procedure, you will be brought to the recovery room, where all of the specially trained nurses will monitor you immediately after surgery. So you will be in the recovery room from anywhere from 30 minutes to 1 hour after surgery. No visitors will be allowed in the recovery room. However, your physician will come to the surgery waiting room and speak to any family or friends in the waiting room and let them know how surgery went. Your family will then be informed of your room location and where you will be transferred to on our orthopedics unit here at Santa Rosa Memorial Hospital. After you have arrived to our orthopedics unit here on 2 Center, you will be rounded on by your nurse and a care partner or nursing assistant. The care partner or nursing assistant will then take your vital signs, which consist of blood pressure, respiratory rate, heart rate, oxygen level, and temperature. Your vital signs will be taken every 4 hours for the first 24 hours after surgery. So that does mean that you will be woken up the first night for your vital signs. Your nurse will advance your diet over a couple of hours after you arrive on the unit. The nurse will first start by giving you ice chips and clear liquids, and then we will advance your diet to more solid foods as you're feeling hungry. Other things that you can expect your first night here in the hospital: you will be hooked up to a continuous pulse oximeter. That is a little sticker that is stuck to your finger, and it will monitor your oxygen level and your heart rate for the first 24 hours after surgery. Your nurse will typically round on you every 2 hours the first night. And every time the nurse rounds on you, if you're awake, she will ask you the question, on a scale from 0 to 10, what number is your pain? So you will be asked that question multiple times during your hospital stay here. Also, on the first night, you will not have to worry about going to the bathroom. You will have a Foley catheter in place. All in all, the reason why I tell you all of these things that you can expect the first night is because you will not get that much sleep the first night, unfortunately. But keep in mind that it is all for your safety and recovery after surgery. It is very important for your remainder of the hospital stay and for any family or friends that will be visiting you to use proper hand hygiene, especially when entering in and out of your room. We do have hand sanitizer outside of every patient room and inside all of the bathrooms. Other things you can expect day to day here at Santa Rosa Memorial on the orthopedics unit: your nurses will round a little more frequently in the daytime. They will typically round every hour or more frequently if needed. And you'll also be rounded on by me, the total joint patient navigator, and possibly the nurse manager to make sure that all of your needs are met while you're here. After your knee replacement surgery, for those of you who are receiving a knee replacement, you will have a bulky dressing over your knee incision. That bulky dressing is entitled a compression dressing, and basically that dressing serves the purpose of preventing too much swelling and bleeding around your knee incision. So that compression dressing is a tan dressing, and it typically goes from mid-calf to mid-thigh. That dressing will be changed the day after surgery to a much smaller dressing that will be easier to walk around in. So all patients will have a metal trapeze over their bed. It is a triangular shape metal device that hangs over your bed, and it is to be used for you to reposition yourself in bed. Some of you may also have a drain coming from your knee incision. For the hip replacement patients, you may also have a drain coming from your incision, but one thing that will be different is that you will have an abduction bolster or abduction pillow placed between your legs to protect your hips from dislocating after surgery. This is what the bolster looks like. Here we have it. And this will be placed in between your legs after surgery. It will go just like this, and you will be strapped in any time that you are in bed. When you get up to go to the bathroom and walk around, of course it will be taken off. We ask that you take this home after surgery and use it for a period of 6 to 8 weeks anytime that you're in bed after surgery. Next, I will talk about preventing complications after joint replacement, some medications that you may be on after surgery, pain management, and nutrition after surgery. So the number one complication after any joint replacement surgery is a blood clot. They are very rare, but it is still the number one complication, so we want you to know what we do to prevent you from developing a blood clot. Well, the first thing that the surgeons will prescribe after your joint replacement surgery is an anticoagulant or a blood thinning medication. You will be prescribed to take that medication for a period of 2 weeks up until 6 weeks after surgery to prevent you from getting a blood clot. Another thing that the surgeons will prescribe for you after surgery are called sequential compression devices. These are little green pumps that go around your calves every time that you're in bed, and they alternately inflate to massage your calves. This keeps the blood flowing in your calves and prevents you from getting blood clots. The sequential compression devices look similar to this here. So these will be placed around your calves after surgery when you're in bed, and any time that you get back in bed from, say, the bathroom or getting up and walking with physical therapy. The last thing that you can do to get yourself from getting blood clots is early ambulation and leg exercises. So we encourage you anytime that you're laying in bed after surgery or sitting for a long period of time to do ankle pumps. We ask that you stick your foot out and pump your ankles back and forth to keep the blood flowing in your calves. And you can also do leg circles or ankle circles to keep the blood flowing. The most important thing to remember is that we want you to get up and move, and you really can't do too many exercises or too many ankle pumps. The next complication that can occur after joint replacement surgery is an infection. Those are also extremely rare, and the infection rate is very low here at Santa Rosa Memorial, but we want you to know what we do here to prevent you from getting a total joint infection after surgery. You will receive 3 antibiotics after your joint replacement surgery that will help prevent you from getting a total joint infection after surgery. The first dose of antibiotics will be given to you right before you go into the operating room, and the second 2 doses will be given to you when you're on the orthopedics unit by your nurse. Those will be given to you within 24 hours after your surgery. Some other medications that you may be started on the night of surgery include pain medication and stool softeners. This brings me to my next topic of constipation. The number one side effect of narcotics is constipation, so it is very important to be proactive. We encourage you to drink 8 to 10 glasses of water a day and keep hydrated. That really helps with constipation. We also encourage you to eat high fiber foods. So now is the time before surgery to stock your house up with high fiber fruits, vegetables, and grains. We also encourage you to purchase over-the-counter stool softeners to take after surgery. We encourage you to buy those now so that they're at your home and ready for when you get home after surgery. You will be asked to take stool softeners for as long as you are taking pain medication at home. So here at the hospital, one of the main goals after surgery is for us to keep your pain at a manageable level after surgery. You will have had a big surgery. So it is almost impossible for us to completely take away your pain, although there are patients that do report no pain after surgery. Our goal here is to make sure that your pain is at a level where you can get up and walk, do your exercises, get to and from the bathroom, and say, yes, I know I have a little bit of pain, but it's manageable and I'm able to do the things I need to do. Most patients say that their pain level on our 0 to 10 pain scale is about a number 3. That will vary based on each individual and your experiences. Go ahead and take a look at our pain scale, and as you'll see, there is a 0 to 10 range. 0 means absolutely no pain, and 10 means this is the worst pain you have ever experienced. So somewhere on that scale, we would like you to report to us how you're feeling at that time. I did mention earlier that the nurses will be asking you this question very frequently, especially every time that they come in your room and round on you. It is important that you communicate with us what your pain level is at as frequently as possible so that we can do our best to keep your pain managed. So we ask that you are proactive about asking for pain medication. You may be at a point where you're not having very much pain, but you notice that your pain level is starting to increase slowly. We request that you talk to your nurse and let her know as soon as you feel like your pain level is increasing at all. That way we can be proactive in giving you pain medication before that number of pain gets too high. Other things that can help with pain management, for knee replacement patients, you will have a nerve block. And as I mentioned before, you will have a one-time injection nerve block or a continuous nerve block. Now, the purpose of this nerve block is purely for pain management. It is an injection that goes right above your knee incision, and it numbs the top of your knee to help with pain. Other things that can help with pain management include ice therapy and other oral pain medications. I'm now going to talk a little bit about nutrition after surgery. It is very important to eat a highly nutritious meal before and after surgery, but especially after surgery because foods high in protein and zinc can aid in recovery and incision healing. If you notice that you're having a poor appetite, which can sometimes occur after a big surgery, opt for frequent small meals or supplements such as Ensures or protein shakes. And when you're here at the hospital, please do not forget to fill out your menus for dinner. I will now talk about arthritis and the joint replacement procedure itself. The right picture is a photo of an arthritic hip joint. On the left, there's a picture of a healthy hip joint. You can see the nice pink area on the left photo. That is healthy articular cartilage. Now, when you have arthritis and are in need of a hip replacement, your hip will look similar to the one on the right, where you can see the pink is worn away. That is where your articular cartilage has degenerated, and you may be at a point where you are bone on bone, if your surgeon says so. This can be very painful and inhibit you from range of motion and walking and doing the things that you need to do on a daily basis. I will now go ahead and pick up the model over here and show you what will happen in your joint replacement surgery, specifically for your hip replacement. If you look right here, this is your hip joint. During surgery, your surgeon will first remove any damaged cartilage or bone from the inside of the acetabular area here. This is what I call the socket area of your hip joint. After that, the surgeon will then remove any damaged cartilage or bone from the top of your femur or the top of your thigh bone. Once your surgeon is ready to place the first portion of your prosthetic, he will first place the acetabular cup portion into your socket of your hip joint. After he's done with that, he will then place the femoral stem inside your femur or your thigh bone. Once that is completed, you will have a new hip joint. For the knee replacement, it is the same mechanism, just a different joint. First, your surgeon will remove any damaged cartilage or bone from the bottom of your femur or your thigh bone. After that, he will then remove any damaged cartilage or bone from the top of your tibia or your calf bone. He will then place the first portion of the prosthetic, the femoral component, just like that. After that, he will then place the tibial tray. In between both metal components of the knee prosthetic, there is a polyethylene layer, and that will be used as your new cartilage between your knee joint. After your surgeon has placed the first three components, he will then resurface the back of your kneecap or your patella. He will resurface the back of your kneecap or your patella with what is called a polyethylene button. It is the same material that is used as your new cartilage in your new joint prosthetic. I will begin by talking about physical therapy now, the rehabilitation process, discharge, and then getting you home after surgery. Physical therapy is one of the most important things that you will need to participate in and stay motivated in after joint replacement. For patients that have a surgery in the early morning hours, physical therapy will be seeing you on the day of surgery. They typically come and do their first session with you 2 to 3 hours after your surgical procedure has ended. For those of you who have a surgery that is later in the afternoon, physical therapy will most likely see you first thing the next morning. The first time that physical therapy comes to see you after joint replacement surgery, they will most likely sit you at the edge of your bed first, stand you, and then walk you 10 to 15 feet if you're able to do so. After the first day, physical therapy will be seeing you twice a day until you leave the hospital. They will be seeing you for a morning session and an afternoon session. The goals of physical therapy before you leave the hospital are to make you as independent as possible. They are there to help you get in and out of your bed on your own or with as little assistance as possible with your coach. Physical therapy also works with you to ambulate or walk up to 100 feet or more before discharge. And they will also help you manipulate stairs if you have stairs in your house and you're concerned about those after surgery. For hip replacement patients, there are 3 main precautions that you will have to abide by after surgery for a period of 6 to 8 weeks in order to prevent you from dislocating that new hip. I will go over all 3 hip precautions, and then I will go over anterior hip precautions for those of you who are receiving an anterior hip replacement. So the first precaution is no bending at the hips or waist past 90 degrees. This also means that you cannot sit on any low couches or chairs. When you sit, you do have to ensure that your hips are always a little higher than your knees. The second precaution is not allowing your operative leg to turn inwards. So naturally, when we sleep, our feet want to turn in or out. What we would like you to do is to prevent your foot from turning inwards when you're laying down or sleeping. The abduction wedge or bolster that you received after surgery will go home with you. We do encourage you to keep this in between your legs when you're sleeping to prevent that leg from turning inwards. The third precaution for hip replacement patients is no crossing your legs. This means that you cannot cross your legs when you're sitting down at your knees or when you're laying down crossing your ankles. For patients that are going to have an anterior approach hip replacement, you also have 3 precautions. The first one is avoid crossing your legs. The second one is avoiding excessive hip extension. And the third one is avoid turning your operative leg outwards. For total knee replacement patients, you only have 1 precaution. That precaution is that we do not want you to sleep with any pillows or rolled blankets underneath the bend of that knee. It is advisable to wear a knee pad when you're kneeling after surgery. And it is very important that anytime you're sleeping or laying down after a knee replacement, that you keep that knee fully extended to prevent knee flexion contracture. Physical therapy will be working with you, as I said before, to go up and down stairs. They will work with you to go up and down stairs using whatever you have in your household for safety. So if you have railings, they will teach you how to go up and down stairs with your railings. If you don't have railings, they will teach you how to go up and down stairs using your walker or maybe your coach by your side. Throughout your recovery, you will hear the phrase up with the good and down with the bad. So that means when you walk up the stairs, you will start going up with your non-operative leg and you will go down with your operative leg. Physical therapy will also be working with you for safe car transfers. So they can work with you and your family in the hospital to maneuver getting into and out of the car safely. Estimated recovery time. You can expect to stay in the hospital for an average of 1 to 2 nights. On your day of discharge, you will be as independent as possible with transferring in and out of bed, in and out of the chair, and on and off the toilet. You will also be able to ambulate or walk 100 feet or more. You will be able to negotiate stair climbing, be independent with exercises, and be independent with car transfers. Getting back to your life. Estimated recovery time, full recovery is anywhere between 6 to 12 months. During the time frame of 4 to 8 weeks, you will be able to return to driving. Please consult your physician about exactly when you can return to driving. During this time frame, you can also return to school or work. And during this 4 to 8 week period, you can also return to doing physical therapy in the pool or aquatic therapy. During the 6 to 12 month period, that's when you can start planning vacations. Of course, you will have to consult your surgeon about your next trip and when it's appropriate. And also during this 6 to 12 month period, you will be able to start doing sports and recreation that maybe you haven't been able to do in a while because of pain and discomfort. So things like golfing, bowling, hiking, walking, cycling, dancing, and tennis are all low impact and acceptable exercises. Water aerobics is also very good for joint replacement patients. We ask that you avoid any high impact exercises, especially repetitive high impact exercises after the joint replacement surgery, such as repetitive running and jumping. We will encourage you to do exercises prior to your surgery. You can locate these exercises in your joint replacement booklet. Every patient will receive this booklet prior to surgery. Your exercises will be located on page 12. We do encourage you to do them before surgery, but if you're unable to do them before surgery because of pain, please read through the exercises and familiarize yourself. You will be doing them after surgery. While you're in the hospital, you will also be seen by our occupational therapists. Occupational therapists will first see you with physical therapy on your day of surgery or the morning after surgery. The occupational therapists educate and demonstrate the use of adaptive equipment devices for you after surgery and help you with self-care. They do review joint precautions with you for hip replacement patients and lower body dressing for those of you that have to abide by hip precautions. Occupational therapists also help you gain independence with toileting, and they evaluate the need for assistive equipment at home, such as shower bars, grab bars, or shower chairs. Now is the time where I will begin talking to you about how to get your house ready prior to joint replacement surgery. The goal of having your house ready before surgery is to make it as safe as possible for you. So I have a few tips for you. It is helpful to have an apron or a belt to pack and carry around items with you around the house after surgery. Please obtain a cordless phone so that you are not running to a phone attached to a wall after surgery. It is also helpful to place a nightlight in your bedroom or bathroom after joint replacement surgery for your safety. You will most likely be taking pain medications, which can increase your risk of falling after surgery. Another helpful tip is to prepare foods ahead of time. So if you know that you'll be alone for periods of time during the day, it is helpful to prepare meals now and freeze them. Or if you'd like resources for meal delivery, I can assist you with that. So please contact me via email or phone. It is also important to make sure that your pathways in your house are clear for walking. All patients that receive a knee and a hip replacement surgery will be using a walker after surgery for a period of a week or two after. It is important that you remove any throw rugs off of the floor because using a walker around throw rugs does put you at a high risk of falling as well. For hip replacement patients, please put pillows or cushions on low chairs or couches, and make sure that you place frequently used items within reach. Here are some examples of bathroom safety, specifically safety grab bars for your shower if you're interested in them. I also have some examples of a bath shower transfer bench or regular shower chairs that can be helpful after surgery. Here are some items that are what I call must-haves after a joint replacement surgery, specifically for hip replacement patients. These are adaptive equipment devices that can help you get dressed and get some things that you need while abiding by your hip replacement precautions. The first adaptive equipment device that is shown here on the screen is a reacher. The reacher can help you grab things that are hard to reach or help you grab things that are located on the ground where you will not be able to bend over for the first few weeks after surgery. The second item is a sock aid. This can help you put on your sock while you're sitting down, especially for hip replacement patients. You will not be able to bend over and tie your shoes or put your socks on, so this can help you put your socks on. The third item is a long-handled bath sponge. This can be helpful in the shower to scrub things that are hard to reach. The next item that is a must-have for hip replacement patients is a bedside commode or a raised toilet seat. And the reason it's a must-have is because most toilets are very low. So your toilets at home are low enough that when you sit down, you will most likely be breaking your hip precautions. So we do ask that you get a raised toilet seat or a bedside commode. This raises up to the height that you need, and it also has handles on each side, so it's easy to get on and off the toilet after surgery. If you're interested in getting a bedside commode, please talk to me, either email me or talk to me after class or call me and I will arrange delivery of the bedside commode for you. Bedside commodes are not typically provided by insurance, covered by insurance, or provided by the hospital. You usually have to pay out of pocket for these items. The next item that I'd like to talk about is elastic shoelaces. I know I mentioned getting slip-on shoes to bring to the hospital for after surgery. You will be using slip-on shoes for a period of time after surgery, usually 4 to 8 weeks. If you do not have any slip-on shoes and you don't want to purchase any, I do suggest buying elastic shoelaces. You can place these elastic shoelaces in your tennis shoes and they then act as slip-on shoes. Now I will talk about discharge planning after surgery. Our discharge time here is typically 10 a.m. to 11 a.m. Our case manager and our home care liaison will be working with you on your discharge plan after surgery. All patients will be required to use a walker for a week or two after surgery. Those walkers will be provided for you by your surgeon's office before surgery. You do not need to bring those walkers to the hospital. We have walkers here for you to use, but if you would like your walker to be measured at your height, please instruct your coach to bring that walker on your day of discharge so that our physical therapist can measure that right before you go home. Most patients that leave the hospital after joint replacement surgery will have physical therapy already scheduled. So depending on what your surgeon would like you to do, you will either have home care physical therapy, which means physical therapy will be coming to your house for a period of 2 to 3 weeks after surgery. They will typically come to your house 2 to 3 days a week for that 2 to 3 week period. After you have done your home care for 2 to 3 weeks, you will then schedule an appointment with an outpatient physical therapy clinic. If your surgeon would like you to go directly to outpatient physical therapy after your discharge from the hospital, then you are instructed to make that appointment prior to coming into the hospital. And sometimes physical therapy clinics can be very busy and booked for a long period of time. So if you know you need to make that appointment, I encourage you to call the physical therapy clinic as soon as you can. If you feel like a skilled nursing facility or a rehab facility is an option for you after joint replacement surgery, please talk to your surgeon as well as me, your patient navigator, and we will help you get the resources that you need. If you would like any other resources such as temporary DMV placards, you can obtain that from your surgeon's office. I do teach a discharge class for family and friends, coaches of the patient on the day of discharge. This class is held Monday through Friday, 10 a.m. to 10:30 a.m. in our 2-center orthopedics conference room. Family members, caregivers, friends, please join us and become educated on the post-operative recovery process. Patients will be ready for discharge home after this class at 10:30 a.m. Finally, don't forget to continue a bowel care regimen once you get home. You will receive a patient satisfaction survey via phone call from a company called Professional Research Consultants about 1 to 2 weeks after surgery. We highly encourage you to answer this survey because this is how we get our feedback here at the hospital about how your hospital stay was. Thank you for watching this presentation on total joint replacement. This was a lot of information to take in before surgery, but it is the first step for a successful recovery after surgery. If you have any questions about your surgery, do not hesitate to give me a call or shoot me an email. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you.